meet your ankle joints. This is another in our series of videos looking at the individual joints of the body. Learning the anatomy is really key, not only to getting the most out of that joint, but also to help keep it safe, to prevent those injuries from happening. Now, the foot and ankle area is a very common area for injuries, and you'll see there are lots of videos about specific injuries in this area. Really key to get this video under your belt first, because it'll give you the groundwork for understanding all the specific injuries themselves. Now, you'll notice that I've separated out into two videos, the foot and the ankle. There's a video called Meet and Greet Your Feet. Now, it's very artificial to cut these two up and treat them as separate entities. They are very much part of an integrated whole, but there's a lot of anatomy here. It's quite a complex area, and it's just too much to take in one chunk. Watch both the videos, but make sure you keep in your mind the fact that these are very integrated. And as you'll see, there's a little repetition here of various muscles that are belonging to both videos, because they really are synergistic and work on both the foot and the ankle. So they're not two separate structures. This is just so that it's not too overwhelming for you on a first visit to these lovely joints. Okay, let's have a look in more detail at the ankle joint. Now, it's made up of the two bones of the lower leg. So we have two bones in the shin area, the lower leg area. We have the tibia, which is the larger bone, the one that's quite sort of prominent on the front of your shin area. And then you have a smaller bone called the fibula, which is what we call a splint bone that runs down the outside of that lower leg. As you'll see at the bottom there, they both end in little bumps, and these are your ankle bones. You can put your fingers on these, you can feel them. What people don't often realise is that your inside ankle bone, the one towards the middle of the body if you were standing in parallel, is on your tibia, and the outside one is on your fibula. They're not on the same bone. As you can see, where they come down, they form a sort of archway, a domed ceiling, if you like, over the top of another bone called the talus or the talus. This is the bone at the top of the ankle area, sitting on top of the foot. And as we point and flex our feet, it rolls forwards and backwards under the arch provided by the tibia and the fibula. That's really the anatomy of the ankle joint. Below that, we've got other structures that you'll see covered in the Meet and Greet Your Feet video. As we're seeing it spin around 3D there, it's good to see how the architecture of that ankle coming down underneath that talus bone, you've got that larger chunky heel bone, it's called your calcaneus. That's the base of the rear part of the foot, and then the talus is sitting on top of that, and then the arch of the ankle joint above it. Let's move on now to looking at some of the ligaments of the ankle. Now, ligaments, if you don't know what they are, watch the Meet Your Soft Tissues video to see the distinction between tendons, ligaments and all these other tissues we have in our body. But essentially, ligaments are there to connect bones to bone. Wherever you've got a bone meeting another bone at a joint, the ligaments are there to provide some stability, because they're like straps. They're not stretchy like a muscle is, so they're quite firm. They're allowing some movement, but they're restricting too much movement. And when we look at things like ankle sprains, where you roll that ankle and push your ankle beyond its allowable range, these ligaments can become damaged. Watch the videos on ankle sprains for more on that. Now, the ankle ligaments, there are lots of them around because there are a lot of joints that need connecting together, and they all have quite sort of lengthy names But when you understand the names of the bones that we just looked at, actually those names aren't quite so complicated as they appear. If we look at that side view or lateral view, what you're looking at there is a right foot from the outside. So we're looking at the outside ankle bone. And you'll see that there are little kind of slips of ligament there. There are 5 of them that we've highlighted here. The top 2 are called the tibio-fibular ligaments. That's because they connect the tibia to the fibula. Okay, not that complicated. Anterior means towards the front of the body, posterior towards the back of the body. So you've got an anterior tibio-fibular ligament and a posterior tibio-fibular ligament. They're a little higher up on those 2 shin bones that are coming downwards. Then around that ankle bone itself, you'll see there are 3 little strips coming off there. The one at the front, again, anything saying anterior means it's towards the front. Here it's a similar name, but a little different. It's the anterior talofibular ligament. Now, we just learnt that that bone that sits under the arch of those 2 shin bones is called the talus or talus. You can pronounce it either way. So the anterior talofibular ligament is connecting the talus bone to the ankle bone, the fibula. Now, that's the one that can get injured in any sort of ankle roll. It's kind of the first in the line of fire when we twist our ankle. Again, watch the ankle sprain video for more on that. Coming around to the lower part there, you see that calcaneofibular ligament. Now, we just mentioned the big heel bone is called your calcaneus, and the ligament is going up to the fibula, the ankle bone on the outside. It's the calcaneofibular ligament. Not as complicated as you might think. And then on the back, guess what? We've got a posterior talofibular ligament. So these names are just like sort of little map references telling you which bones are being connected by those particular ligaments. You know the names of the bones, you can figure out what these ligaments are doing. So they're there to give a little stability to that outside part of the ankle, but allow also for some movement. Now, because they're not very strong, you can see they're just like little strips. That's why we often damage them more often on that outside than we do on the inside of the ankle, which if we now look towards the right of the picture, we'll see the ligaments on the inside. So now we're looking at your inside ankle bone. And you'll see there we've got quite a sort of thick fan of ligaments coming down. And we call them collectively the medial deltoid ligament. Up on the ankle bone, all those ligaments are sort of clustered together around the bottom edge of that inside ankle bone, which remember is on your tibia bone. And then they fan out into little different slips that come down and attach to various bones around the inside of that ankle joint. They do have individual names, but they get a little bit crazy, so we just tend to put them in one bucket and call them the medial deltoid ligament, because typically if you injure that ligament, it gets injured as a group rather than just the individual strands. That side you can see is a little bit more stable because there's a lot more integrity to the ligaments there versus those little thin ones on the outside. That's why it's less common to damage this inside ligament of the ankle versus the outside. And go and watch the ankle sprain video for some other reasons why that's the case too. Okay, now we've got quite a lot of muscles here and I'm going to set these guys spinning. We're starting off with the muscles that point the ankle. Now, the fancy term for that in anatomy is called plantar flexion. Anything that says plantar kind of refers to the undersurface of your foot. It's the bit that plants itself into the surface of the ground, right? So the plantar surface of your foot is the sole of the foot. Plantar flexion means you're flexing the ankle towards that plantar direction, the sole of your foot direction. We just call that pointing the foot or pointing the ankle in dance. There are several muscles that are involved in this movement, and we're starting from the surface level and working our way down. So that gastrocnemius on the far left there is the big fleshy calf muscle that you can put your hands straight on if you touch the back of your lower leg area. Now, what you can see with that gastrocs, as we call it for short, is that it also crosses your knee joint. If you watch the Meet Your Knee Joint video, you'll see that it also has some action on the knee joint, but primarily its main role is to act on the ankle joint. You can see as the muscle comes down, it becomes a tendon. Watch the Meet Your Soft Tissues video to learn that all muscles end in tendons. The tendon in this case is our Achilles, which we're going to look at in just a moment. So the gastrocs muscle comes down and becomes the Achilles at the bottom. And you can see towards the top, towards the knee end, it kind of splits in two and has two attachment points up on your thigh bone behind the knee. So the gastrocs crosses two joints. Its main job is to plantar flex, to point that ankle, but it does so primarily when our knees are in a straight position. So think of doing a rise. So it's not just pointing our feet. When you just push up into a rise position, that's again a plantar flexion motion. And the gastrocs is working hardest when we're doing that with our knees straight. So like when you're just doing rise or releve position. Underneath it, we have another muscle called the soleus, the one in the middle here. Now that also comes down and becomes the Achilles tendon. So we've got two muscles that become that one tendon, and that's why we often just clump them together as the calf muscles. But as you'll see with the soleus muscle, it doesn't cross the knee joint. It comes up and it's just attaching to the back of our two lower leg bones, but it's not across that knee joint. That means that it's only acting on the ankle joint, and it's more active when our knees are bent and then we go into that plantar flexed position. Think about taking off and landing from a jump. As dancers, typically we're doing that from a plie position, right? A knee bent position. So when our knees are bent, that soleus is primarily active. It's very, very active, particularly as we're landing from jumps to help us decelerate and control our jump landings. And it can often get into trouble when people have a calf strain, when you've got tension or soreness in those calf muscles. A lot of the time it's that deep soleus muscle that's the one causing most of those symptoms, but often people don't know it exists. They only think about that outer layer of the calf muscle, and so they don't take care of it. Go and watch the Safe Flexibility series to see how to stretch these two muscles individually, because you need to target them in different ways. And if you miss out the soleus, you'll wonder why you think you're stretching your calf muscle, but it's not actually helping the problem. So those two are both the muscles that operate via the Achilles tendon, which comes down and attaches onto your heel bone. There's another one under there called the plantaris. And you can see it's kind of a weird looking muscle. It's got a little muscle belly, as we call it. The sort of contractile portion of the muscle is up around the knee joint. Again, it's active in bending your knee. Then it has a really long, thin tendon that runs down that calf area, and it also attaches onto that heel bone right next to your Achilles. So it's sort of operating in a similar way to the calf muscles. When you look at Achilles injuries, there's a video on Achilles tendon injuries. Sometimes the plantaris is the one causing the problem. People think they've got an Achilles issue when it's actually the plantaris. Watch that video to understand the distinction between the two. Okay, so that's the more what we call superficial, the muscles that are a little nearer the surface. We mentioned that those come down, or certainly the first two, the gastrocs and soleus, come down and become the Achilles tendon. So let's just have a look at that before we get into the other muscles. Now, Achilles, everybody's heard of their Achilles. It's very obvious. You can get your fingers on it right around the heel bone area, and it can be prone to inflammation. So it's attaching to that heel bone, and it comes up, and it's really up into that mid-calf area. That tendon is still a tendon and not a muscle. The tendon fibres blend in and become a muscle. Again, watch the Meet Your Soft Tissues video to see more specifically the anatomy of a tendon itself. But where that tendon comes down and attaches to the heel bone, we've also got some other structures called bursae, or one is a bursa, plural is bursae. And around the attachment of the Achilles to the heel bone, we've got two of these little bursae. Now, a bursa is like a little pillow. It's a little sac of fluid, and wherever you have tendons attaching to bone, it's quite a load point, right? Therefore, we need a little bit of cushioning there. And around that Achilles tendon, we've got two bursas or bursae, one nearer the surface, and that's called the tendocalcaneal bursa, calcaneo bursa, and that sits really sort of between the skin and the tendon where it's attaching to the bone. Then we've got a deeper one that sits underneath the tendon, between the tendon and the bone. So we've got two of these little cushions there. They help to reduce the friction that's going on. Think about jumping and taking off repetitively like we do as dancers. There's a lot of frictional force coming through that tendon, and the bursa or bursae are there to protect that and reduce that friction so that it's not pulling on the bone so much. Now, those can get irritated as well, and we can get something called bursitis. Remember, itis just means inflammation of whatever came before it, a bursa in this case. The superficial one typically gets into trouble from things rubbing on it. Now, dance shoes that have drawstrings in them that run right around that heel area. Sometimes if your drawstrings are too tight or your shoes are too tight around that heel area, you get a lot of rubbing, and that can often irritate that superficial bursa there, the tendocalcaneo bursa. The retrocalcaneo bursa is more likely to get involved when we've got an Achilles tendon injury going on. They can often go hand in hand. So that typically comes from more of a mechanical force rather than a rubbing force. But those are other things that can get angry in that ankle area that you might not realise. You might think, oh, I've got Achilles tendonitis, when it's actually the bursa causing the problem. Watch the Achilles tendon injury video to find out more about these. Okay, now let's go back to the muscles, and we've looked at those more surface muscles. Take those away and you've got more underneath. On the far left there, we have what's called the tibialis posterior. Again, fancy name, but we now know the shin bone is called, or the main shin bone is called the tibia. So the tibialis muscle is attached to the tibia, and it's posterior because it's on the back of the bone, the back of the body. We've taken away our big fleshy calf muscles, the gastroc soleus. This one is deep to that. Now you can see it runs down, it actually attaches to both those lower leg bones. It runs down and its tendon comes around the inside ankle joint and attaches under the arch of the foot there onto some of what we call the tarsal bones, which are the pebble-like bones in the middle of the foot where our arch is. This again points the foot. It also has another action which we'll look at in a moment. Now the next two, flexor digitorum longus in the middle there, FDL we call it for short, it's flexing, right? That's that fancy name for pointing, plantar flexion. And as you can see, it comes down under the foot and it splits into 4 tendons that go to your toes. The fancy name for your toes are digits. Therefore, it's the muscle that flexes the toes. I cover these muscles in more detail in the foot video because they're acting on the toes, but they do have also an effect, or they help out with pointing the ankle, which is why I've also included them here. You can see that that tendon also runs around that inside ankle bone, and this one just goes up and attaches to the back of your tibia bone. On the far right, we've got the flexor hallucis longus. Your hallux is your big toe. The flexor hallucis means it's the muscle that points your big toe. Longus, the reason both these two have longus on the end of them is because they are long muscles, and it indicates there's also a short muscle that also does the same action. Watch the foot video to see the flexor digitorum brevis and the flexor hallucis brevis. They're in that video. So again, this one just points, the hallucis just points your big toe, but it also helps out with ankle pointing. We've talked about muscles that point the foot, what we call plantar flexion. Now let's talk about muscles that flex, that what we call as dancers flex the ankle. This is dorsiflexion. If you think of the word dorsal, if you think of a shark, the fins on the back of a shark are called the dorsal fins. So anything on the top or the back of the body is referred to as the dorsal area. Therefore, dorsiflexion is flexing your foot up towards the top part of your foot. We just call it flexing, much easier. On the far left there, guess what? A tibialis anterior. Most of these muscles are mirrored front to back of the body. So this is a muscle that runs down the front of the shin, and it's on the tibia bone, and it comes down, and again it attaches to those tarsal bones of the foot in that arch area. This muscle you can get your fingers on. It is near the surface because we're now on the front of the shin. In the middle of your shin area, you can feel the bone, but if you go slightly towards the outside of your shin area, you'll find this tibialis anterior muscle. If you put your fingers there and flex your foot up, you'll feel it contracting, and you can feel it in action. A little bit deeper than that, we have the extensor digitorum longus, because extension is actually the anatomical word for pulling your toes upwards in what we call a flexing position. It's very confusing because we use different language to the terminology that's used in anatomy. But these are reflections of that FDL and FHL. Here we've got an EDL, which runs down, and just like that one on the back, you've got a thin muscle along the front of the shin area. It splits into 4 tendons, goes to your digits, your toes, and it's the one that pulls the toes up. So primarily acting on the toes, but we've included it here because it does help out with ankle motion. And then you've got another one that goes to your big toe on the right there. Again, helps out with ankle flexion. Go and look at the foot videos for more info on those two, where I get into more detail. So we've looked at the things that point our feet and the things that flex the ankle up. Now we want to look at other motions. Now we know that the ankle joint has a lot of motion, right? We can point it and flex it, but we can also point it inwards and outwards. We can circle it. That's called circumduction. Let's look at the muscles that operate those motions, because they're important, particularly when we're rehabbing from an injury. When we look at the motion where we pull our foot inwards towards the middle of the body, in the dance world we call that sickling the foot. The fancy term for that is inversion. We are inverting our foot. We can invert it at the ankle. The foot has its own motions as well, but we're looking at this primarily from the perspective of the ankle. Now, we've already seen these two muscles on the left there, the tibialis anterior and its partner, the tibialis posterior. They both did different things in terms of pointing and flexing, but when it comes to inverting, they both do the same job. They work together. So sometimes muscles work in what we call antagonistic pairs, in that they do opposite jobs. But in other motions, they can actually work together. We call that co-contracting, so they contract together. So if you are sickling your foot, then both these muscles work together to do that. On the other side, we've got the muscles that do the opposite of that. We call it winging or fishing the foot, where you pull the foot towards the outside of the body. The fancy term for that is eversion. So inversion, eversion are two opposites, going in, going out. And the muscles that are primarily involved in this eversion movement are called the perineal muscles. And again, we use that as a group term, but there are actually mainly two muscles and even three in some people. Not everybody has the third one. We've got that peroneus longus, the blue one. Now these are running down that fibula bone, the splint bone on the outside of your lower leg. If you prod down that outside aspect of your lower leg area, you'll feel these muscles. And if you prod down that area and wing your foot, you'll feel them tighten up and acting. They're often quite tender because they're not easy to stretch like our calf muscles are, and therefore they tend to get a little tight and we don't take care of them. Watch the stretching video series because I'll show you how to release these muscles in the absence of actually being able to stretch them. So again, we've got a longus, which is the long one. It comes all the way down the outside of your shin area. Now these ones wrap around the outside ankle bone. And as you can see, it comes around and it goes all the way under the arch of the foot. So it's also part of the anatomy that supports the arch of the foot. But its job is to pull that foot outwards, or one of its main jobs. Underneath that, we have one called the peroneus brevis. Brevis means short. And as you can just see, as you get that back view there, it doesn't go all the way up because it's the short one. It really starts just a third of the way down that fibula bone area. And then it comes along with the peroneus longus around the ankle bone. But it's only attaching onto one of the outer bones of the foot. It doesn't come all the way under the ankle because it's the short one. But it's helping with that same motion. Now the peroneus tertius is the little green one, and you can see that's actually coming from the front of the fibula bone, and it's just coming down around the front of that ankle bone and attaching onto a little bone on the outside of the foot. Some people have this, some people don't, but if you do have one, it's also helping with that winging or fishing motion. Little quick visit of the ankle area, but hopefully that gives you the grounding and the jigsaw pieces that can help you better understand the motion at the ankle joint and also understand what's happening underneath the various injuries that we might see.